Salam sejahtera untuk kita semua. Selamat datang teman-teman dan dokter yang sudah hadir dalam room ini. Selamat datang di Kuliah Umum Herpet dengan topik Treatment for the Forbidden. Dengan kami yang memulai acara ini yaitu Cluster Herpet Improsatli FKH IPB University. Selamat datang semuanya teman-teman. Semoga teman-teman dalam keadaan sehat, sekeluarga, dan bahagia semuanya. Pada malam hari ini kita akan mengadakan kuliah umum dari klaster Herpet di Improsatli dengan judul Treatment for the Forbidden dengan mengusung tema Venomous Reptile Medicine. Jadi kita nanti akan belajar tentang bagaimana cara mengobati hewan reptil tentunya khususnya yang beracun atau yang venomous. Jadi nanti teman-teman bisa memperhatikan juga mencatat nih ada apa-apa aja sih yang sekiranya bisa nanti kita lakukan jika kita menemui hewan-hewan tersebut gitu. Terlebih untuk mahasiswi kedokteran hewan gitu. Bisa di next. Salawat serta salam saya haturkan kepada Nabi besar kita, Nabi Muhammad SAW, juga kepada Allah Subhanahu Wa Taala hingga akhirnya kita bisa berkumpul di room ini dengan keadaan sehat dan bahagia. Semoga kita semua selalu dalam keadaan sehat sampai ke depannya nanti, sampai kita bisa menemui dunia tanpa pandemi nantinya ya teman-teman semuanya. Juga sekarang ini kita di room ini sudah ada 98 orang, 98 partisipan, juga telah hadir bersama kita Dokter Puveanthan untuk narasumber kita malam ini. Selamat malam, Dok. Mungkin teman-teman yang udah ada hadir di sini bisa komen nih di kolom chat, udah ada dari mana-mana aja, soalnya info yang udah daftar nih banyak banget nih, udah 100-an lebih, dan itu dari beragam universitas tuh, nggak cuma dari IPB aja. Mungkin teman-teman bisa komen nih dari instansi mana aja nih, sambil kita memulai. Oke, mungkin bisa di next. Baiklah, sebelum kita memulai kuliah umum pada malam hari ini, kita dengarkan sambutan dulu dari teman kita, yaitu Alpha Cluster Herpet, kepada Ramon Rahman bin Ragu Rahman. Time is yours.
Hello guys, selamat malam. Thanks everyone for coming, especially from everyone from other universities and also anak-anak sakti kita sendiri. Thank you Dr. Puven for coming out and taking out your time to actually teach us and share with us your experiences, and also at least everyone here gets to know the basics of it, and also maybe in the future there will be some people here who see this seminar and they'll be like, okay, I want to enter into wildlife medicine because I feel very interested in this. So thank you for your time, and especially for all the other, I'm sure there are other doctors there that are attending as well. Terima kasih ya untuk for coming. That is all from me. Thank you guys.
Oke, terima kasih Ramon atas sambutannya. Sebelum kita speaker introduction nih, mungkin saya belum perkenalan diri juga ke teman-teman. Jadi sebelumnya selamat datang teman-teman. Perkenalkan saya Ami dari klaster Herpet juga, tentunya dari Himpro Satwa Liar yang akan menemani teman-teman pada malam hari ini. Jadi langsung aja kita ke acara yang kita tunggu-tunggu, yaitu kuliah pada malam hari ini dengan dokter hewan Puveanthan Nagappan Govendan. Bisa dilanjutkan? Nah, jadi Dokter Puveanthan ini yang sudah hadir bersama kita adalah lulusan dari Universitas Udayana, juga dari UGM. Jadi ada beberapa nih working experiences dari Dokter Puveanthan nih, bisa kita lihat bersama. Beliau pernah bekerja di Animal Clinic Setiawan pertama, juga tergabung dalam FHI, yaitu Field Herping Indonesia, sebagai Field Herping Reporter, juga sebagai Field Assistant di Slow Loris Research, juga pernah internship di wildlife, yaitu di Waikambas, di Peninsula Malaysia, juga di Bali, dan di Nusa Penida. Dokter ini juga pernah internship di Sunset Vet Bali, juga menjadi veterinary technician di Sunset Vet Bali. Dia juga pernah bekerja di zoological breeding farm, dan juga di Kaliko Clinic, serta di Bali Reptile Park, dan Care Clinic Hewan. Bisa dilanjut. Nah, tanpa menunggu dan berlama-lama lagi, langsung saja kita perhatikan, dan mungkin nanti teman-teman bisa mengambil ilmu sebanyak-banyaknya dari Dokter Puveanthan ini. Juga for your information nih guys, jadi dokternya ini bisa bahasa Indonesia juga, bahasa Inggris juga sudah pasti, dan juga dokternya bisa bahasa Jawa nih guys. Jadi nanti mungkin bisa ditanyakan dengan beragam bahasa sesuai kebiasaan dokternya. Jadi nanti kita akan ada sesi diskusi setelah ini. Mungkin teman-teman bisa mempersiapkan pertanyaannya juga setelah ini. Kepada Dokter Puveanthan, waktu dan layar saya persilakan.
Halo, selamat malam semua.
Dok.
Ya, terima kasih banyak atas terima kasih untuk kesempatan ini. Oke, aku tadi biar saya bicara dalam bahasa Inggris ya. Udah lama nggak bicara dalam bahasa Indonesia kaku deh. Nggak mau formal sangat. Nah, sebelum kita pergi ke Venomous Snake Medicine atau Venomous Reptile Medicine, aku ingin sedikit brief introduction of herpetology. Izinkan aku berbicara dalam bahasa Inggris ya. Maaf ya, konco-konco neng kono. Oke, ini brief introduction. Okay. Herp animals, these are commonly found in conservation sites, zoos, and has exotic pets. There's a lot of endangered reptiles and amphibians that need veterinary assistance. Okay. Also, let's not see that reptiles are also expensive animals, and the captive population is huge. Okay, it's very huge, and yet it's medically ignored by veterinarians until recently. Okay. Basically vets, kita harusnya ngapain sih? Kita harus tahu apa sih yang normal itu di reptil. Okay. Kita lanjutin. Sebelum we go any further, this is a small incident. Okay, in Madagascar, ada kura-kura Fanchuras ini yang dibawa they brought to a veterinary clinic and they were asking, can you take the microchip out of the tortoise? Okay, this is a super endangered tortoise. So as vets, this will happen to us, and we should be able to, say yes to certain things and say no to certain things. We should also remember we should report certain things, such as cases. Bisa dengar nggak sih?
Mau terdengar dok.
Apa?
Terdengar dok.
Oh, ya. Okay, terus ini adalah satu. This is something I would really like all of you all to ask yourself these 5 questions before you work or you treat with you are trying to treat any reptiles. What is the species? What is the sex of the particular animal? How does it breed? Okay, dia bertelur atau lahirin. Ya, apakah diet normalnya? Di manakah habitat normalnya? Okay, you should ask all this. Ini adalah salah satu mentorku, Dr. Matteo Oliveri. Dia sering nanyakan ini. If you don't know, don't worry. Google. There's always Google, and ask someone who understands reptiles. At least you'll know the genus of the animals. Then you can go with all the other information. Okay, I'm going to skip a lot. To us vets, what is the most important thing? As what I said earlier, normal. What is normal? Kalau kita nggak tahu normal, gimana sih kita mau mengobati suatu hewan? Oke, ini semua teori banyak. Nah, ini sedikit saja. Reptilia ini bisa dibagi menjadi dua, anapsida dan diapsida. Anapsida adalah semua jenis kura-kura, penyu, dan lain-lain. Diapsida ini adalah squamates. Squamates ini bisa dibagi menjadi dua, yaitu snakes and lizards. Terus ada crocodilia, buaya, buaya darat, semua masuk ke sini. Terus ada rhinocephalia, yaitu tuatharas. Okay, this is interesting. Terus Selonians, Selonians ini aku juga dulu di Selonian ya, Selonia, Satli. Nah ini Selonia ini bisa dibagi menjadi dua ya, Pleurodira and Cryptodira. I think most of you all should know all this. Pleurodira adalah side neck turtles yang akan ini. Cryptodira, I'm not going to talk too much about turtles. Cryptodira are all the straight neck ones. Ini kita bisa kurang lebih lihat. This is just a little bit anatomy on them. And then a little more here and there. I'm not going to speak too much about tortoises, turtles here. Let's see a little about sexing tortoises and turtles. We should understand that not all species, they are similar. Tail length for most species, the males have the longer ones. Why? They have the phallus. They have the phallus there, and then certain species they have the plastron, which is curved or dented, and then certain species they have the anal plates which differ between males and females, and then some species they have the intergular scutes as seperti sulcata, Centrochalis sulcatas, and then sizes. Certain turtles, the females are bigger, certain tortoises, the males are bigger, and some of them they have claws. Why do they need the claws? To hold on to the females when they are mating. Some of them they have the carapace shape, the waist in a female, like redfoot tortoises. They have the H shape, pupil color. Some of the what do you call that? Batagur species or kalagur nowadays they call it. Mereka pupilnya itu akan berubah mengikuti musim kawinnya. Ini just a little bit, you can see the tail differences between a male and a female. Ini Centrochalis sulcata, you can see ada intragular scutnya itu. They fight among males. What will happen is usually, why do they have this? Is the males will attack the other males, they'll push them, turn turtle, and usually these males will die because they can't turn themselves up. This is a very interesting mechanism in tortoises, some of the species where they have the intragular scutes. Here we can see some of the long tails and so on. Squamates. This is an interesting chapter. You'll see this a little more. They have movable quadrate bones. Interesting here. Lepidosaurians. Ini I don't want to be too bored here, terlalu theoretical. Tapi aku akan sering bilang, let's go to Tekaglossa di sini. Di Tekaglossa ini you can see haloderms, yaitu gila monster, bearded lizard, and then varanids, and then serpents. What is so interesting that coba kamu lihat lidahnya. Lidahnya itu semuanya mirip. Beda dengan kadal-kadal jenis lain. Beda dengan iguana, beda dengan semua yang lain. Serpents semuanya lidah bercabang, sama dengan varanid, sama dengan haloderms. This is an interesting point. Why? Soalnya kebanyakan obat-obat yang digunakan itu akan mengikuti dosis ular dibanding dosis-dosis kadal-kadal. I'm not going to talk too much about this. This is too basic for you all. I'm going to just show you a little bit here, and then we are going to jump to the venomous snakes. How do you sex a snake? You have a few methods you can do. Visualizing, it's not certain. Transilluminating, it's not certain. Popping, yes, you can see the hemipenis of a snake, but in certain species like retics or even like some species, you don't want to pop. How about venomous snakes? Ya pasti you nggak ada waktu untuk pop. Percaya nggak orang yang handle? Ya aku sih orang. Ya probing ya one of the best methods, but definitely there's other ways. This is the visualization, to differ male and a female. This is a transilluminating method. You put the light and you see the hemipenis and so on. Ini adalah popping, cara-cara popping. Ini popping Dendrolaphis pictus, bisa pop. And then cons of popping, terkadang keluar mass gland. Okay, scent ini akan sangat terlalu parah baunya. Okay, and sometimes you can also injure the hemipenis of a snake. Okay, why? Because too much pressure is given. Some large constrictors itu susah. Ini adalah salah satu teman dokter hewan umbu sedang probing Psychopithecus reticulatus. Cara metode-metode lain. Okay, you got to see, you know this. I'm going to skip this. Colubridae. Okay, so we're going to skip all this for a while. These are venomous snakes, yeah, venomous snakes, and I'm going to talk about this in the next slides. Yeah, give me 1 minute. Bisa lihat slide-nya enggak?
Bisa dok, terlihat. Tapi baca sekarang.
Yang terbaru ya?
Iya, urutan ke-56 sekarang.
Enggak, udah new sheet.
Oke.
Okay. Sorry. Okay, venomous reptile medicine and surgery, treatment for the forbidden. Yeah. Okay, this is an interesting one. Okay, I would like to say only about 15% of 3,000 snake species are considered dangerous to humans. Okay, most of the venomous snake kita jumpanya itu adalah di aquaria, di zoo, wildlife rescue center, venom collection center, private collectors, and maybe even local snake rescue groups. Mungkin seperti kalian yang di Herpet di setiap kampus, you know, you all are doing this. Aku tahu di Bali mungkin Dr. Sulham, ada Beta, ada Alaya, they are all doing this rescue. And then I know even in IPB, the Sean, I see you doing a good job. Sometimes we come across, you know, these snakes could be injured, yeah, and what can we do? Okay, but before that, you know, we always have to differentiate venomous and poisonous. Venomous, most snakes are venomous. Okay, there's one snake which is still debatable, Rhabdophis summiatus. Anyone who's interested, nanti you boleh baca lebih banyak tentang itu. They consider it as poisonous these days. Yeah? This is a slide we always see. Okay, this is by the Fish and Wildlife of Florida. This is a method where they use to identify venomous and non-venomous snake. I will say this is useless here. Okay, this is totally useless. The top part, you know, they can give all that for cobra, and the bottom part it fits even a boiga dendrophila will fit there. Not the heat sands and so on. Tapi, you know, this is something you cannot use here. It has complicated the whole world actually. Orang-orang yang ingin tahu venomous and non-venomous. This is something which has, you know, confused all of us. Okay, many clients do not handle venomous reptile in safe manner. I would like to always say, it is important not to rely on clients' experience. Okay. If you have no experience handling venomous reptiles, do not work with them. Jangan kerja dengan mereka. Okay, one may practice these techniques on non-venomous reptiles. You can always try practicing with non-venomous reptiles. Yeah? What is important is identifying, first of all, are you confident enough to identify and make sure this is the particular species? If not, treat it as highly venomous snake. Secondly, we are going to talk a little about, we can always see the physical restraining about the animal. There's a lot of methods. Ini sih kayaknya di setiap kampus harusnya kalau ada satli, ya kalian pasti ada training-training tertentu, dan I feel like you all would know. Chemical restraining ini kita bisa menggunakan pembiusan systemic, and you can, some of them you can even use inhalation and so on. And then there'll be necessary procedures where you want to treat this venomous snakes. Again, you know what I'm saying. And then at venomous reptiles, you can always see at Thecoglossa, there's always these three things: varanids, heloderms, and also serpents. Whereas the venomous ones are only heloderms and serpents. If you see, there will be a lot of researchers who always try to prove, always try to say that varanids are venomous. Okay, this could always be a reason why. You see how close they are actually. Okay, they're all under the thecoglossa and they're very close. That is why, you know, don't be surprised if they can just say that one of the varanid is definitely venomous and so on. The studies are going on, a lot of interesting things. Okay, venom, there's a lot of type of venoms. Okay, ada yang neurotoxin, neotoxin, cytotoxin, and so on. You always got to remember that most of the venoms, it is numerous different toxins that, you know, it combines into one snake. Some of them you'll be, it's quite an interesting protein study actually. And then I'm just showing you an example of a snake bite of a Calosolasma rhodostoma here. This is something we don't want to play with. Okay, an accident will just happen anytime, and if you are handling one of these snakes for treatment and so on, this would not be a good idea. In Indonesia, we have sabu, yaitu Serum antibisa ular. There's 3 species there. It's the Najas putatrix, we have Calosolasma rhodostoma, and Bungarus fasciatus. Okay, you'll be quite lucky to get the treatment, and you know, sometimes it's just too late. Yeah, these snakes are very painful. Okay, let's talk a little bit about viperides. There are true vipers and also pit vipers. Only true vipers in Indonesia is the Boya siamensis, and we have the other one, the Boya russellii in India, South Asia actually. Others are all pit vipers, and most of them are highly venomous. All of them are highly venomous. They are all selenoglyphas. They have flexible fangs. Okay, you got to be very careful when you're handling them. Like I've seen people who actually do the python grip on what do you call this, pit vipers, and they actually got punctured. It happens. You got to be very careful. These are 2 specimens I've seen and worked with. This is a Wegleri in Bali Reptile Park, and it's a Ophis monticola in Taiping Zoo. Okay, another Wegleri. The heat sensors in some snakes, yeah, you can see that pythons and also pit vipers, they have the heat pits. Okay, some of them call the infrareds and so on. That's how they see, and roughly be very careful with them. Okay, elapids are all highly venomous snakes. Seriously, there's no room for mistakes when while handling. There's no room for mistakes. If you do a mistake, that's about it. Okay, absence of L'Oreal scale, which differs with most colubrids. Why is this important? Okay, like in Bali, when we are working there with venomous snakes and with snakes in general, sometimes you can get like a rescue on a black snake, and when you go and you'll be like, oh, it could be a what do you call that, a common wolf snake, Lycodon capucinus. And then when you handle it and when you take it back, and then you see that is actually a Bungarus candidus. Previously, it was known as Bungarus javanicus. It's a black form of a Bungarus candidus. It's a very interesting species, but you know, there's no room for mistakes. So please always be careful. When you see something different, always check for, you know, whatever you can check, just keep it in a bottle, keep it as safe as possible. They all are Proterioglyphas. They have fixed fangs. Do we have to treat these snakes? You know, it's a question you ask yourself. If you have interest in reptile and you have interest in wildlife, sometimes I would say, it all depends on you. There is no one who's going to force you to go and treat a king cobra. If you, as a vet, and you have the interest, you have the passion, and you are confident enough to do it, I'll say, yeah, we need more of you guys. Caution when you're handling spitters, both Indonesian cobras. We have the Najas sumatrana and the Najas putatrix. They are both spitters. Working with them, selalu kita pernah, mungkin ada orang yang pernah kerja dengan Najas sumatrana. They are crazy spitters. I don't know how big is the venom gland, and they just produce and produce and produce venom. Okay, colubrids, the species, they could be Aglypha, they can be Osteoglypha. And it's interesting that the only snake species with L'Oreal scales. I know there's 1 or 2 species which, you know, they're still in a big debate right now. A few years ago, this is a particular Rhabdophis miatus in Kebun Raya Bogor, actually, this particular one. And so always try to use tools. And This is a white boiga dendrophila. These are the basic tools you always use when you're working with reptiles. There's always a bag. Okay, there's always gloves. You can always use a glove when you're handling color. You all watch the Simon from South Africa. He uses the glove a lot because he's working with mambas. Okay, he needs a good grip. And working with mambas, forget about using hooks, snake hooks, spinning them. No, you need a thong. You need to go in directly. Snake probes. I like to use probes not just for probing and knowing if it's a male or a female, but I like to use probes to actually check for the oral cavity. Anything inside, use a probe. It's more blunt. It works pretty well. And you have this what do you call that for birds? You can also use that for tortoises and even snakes. Last but not least, the snake tubes. Works perfectly. If you're a vet student, you like reptiles and you want to work with what do you call that? Venomous reptiles. This is a must. Okay, this is a must. These are proper techniques. You can use to handle them. You can always use one hook, two hook methods. Handling them. This is a gabun wiper, I suppose. Snake tubing. There's some methods of tubing them. We'll see later, tubing snakes, and you can see one of these. This thing was taken in Jogja. Okay, this is a very interesting thing, and this was Mustang, if you all know, and he breeds Naja-Kotia, some Corlatus, and also Naja samarensis. Samarensis is a spitter, yeah, and when you put them in tubes, sometimes they can just spit everything out, and he puts this so he blocks everything. He even blocks the snakes from going the other way. It's a very interesting thing. I've not seen one. Maybe you guys have seen, but this is interesting. This is a method I like to always use. The tubes, put it in a tub, put the snake in the tub, let the snake go inside. Slowly, when it goes in, you get a grip, proper grip. Now you can do whatever you want to do. You want to check for the heart, you want to use a Doppler, go ahead. You want to take blood, through the cardia. Yeah, I don't really like that. Or the tail, go ahead. You want to check for the mouth, be careful. Okay, you can do a lot of things here. But okay, you got to always be confident that you are really sure there's no issues. There's no way of you saying, "Oh, is the snake ready inside?" or "Am I really confident?" Don't doubt yourself. When you're dealing with venomous snakes, that's one thing you really want to make sure. Don't doubt yourself when you're dealing it. If you're confident, yeah, take it. If not, just leave it. Don't say maybe yes, I can do this. No. This is another method. I really like this method. I actually told some of my friends in Bali, Dr. Sulham, Ayala, to take a photo of this whole remake thing. Terima kasih ya Sulham. You put the snake in the bucket. I don't know why it's a pink bucket. Definitely some girls kosan mungkin ya. You put the snake in the bucket, fill it with water, and you put the tube in. The snake will automatically start going in. Okay, and then you can handle it and you can do whatever procedures you want to do. This is a very close friend of mine, and in my room back in Bali last time. This is Trimeresurus insularis, and you can see it wasn't a clear tube, but it works pretty well. These are methods of you putting a snake into the bag and tying it. There's always be careful. Put the snake in, make sure it's in, and then put a hook there to make sure it's really in. Push the hook, make sure the snake is far away. You can hold the hook down, tie it. Make sure, and don't hold any of this part. You see, there's always an extra part. You got to design bags and so on. I'm pretty sure some of y'all should know this. Just be very careful. They can bite through bags. This is both Naja-Kotias, beautiful snakes. It's in Jogja. These are some of the snakes I've worked with. The first one, it's a Sputatrix. I call it Cocodipsy. It's in Bogor, actually. This is in Bali. It's Ophiophagus hana and another Naja-Kotia. Okay. These are both Bungarus fasciatus. And okay, let's talk a little bit about surgeries. Venomite surgeries to remove the venom gland. This is performed in an adult eastern diamondback rattlesnake. Okay. Is it necessary for you to do this? There is always a big debate going on. Some people, they are totally against it, and some are like, you can still do it because people will be safer. why do you have to handle a snake, a venomous snake like a ball python? No, there's no reason for you to do that. But there's also like certain pathologies that you can't escape, and you have to remove the venom gland. Venom is also something which is very useful for snakes to digest the prey. It gets a pre-digest status, you know. And then if there is a pathology that you have to remove it, there's methods to remove it. Me personally, I've never worked removing one, but I've tried on roadkills. Ular-ular yang mati di jalan, sometimes you can take them back. Make sure you're very careful because they can still, so make sure the snake is really dead, and then try to go in, and I tried that. Don't try this at home. Yeah. This is an interesting case. I'll just share a few cases I've worked with. This is a Naja samarensis. It was in Jogja. It came out of the egg, and badannya itu lekuk-lekuk. Nah, ini some of the people, they say this is due to incubation temperature. This guy has been breeding snakes for tons of years, and he said there was a fluctuation. Yeah. Do I have time?
Bisa dilanjutkan, dokter?
Oh ya, ini you can see, ini dengan Dokter Slamet sebenarnya, Dokter Slamet Raharjo. We were deciding apa ini mungkin bisa nggak bagian ini dipotong, terus tulangnya itu apa bisa. Namun ini didebatkan lagi, mungkin tulangnya itu memang udah bermasalah, jadi gak ada gunanya you potong this. Tapi sometimes kalau organnya udah lewat ke sini bagian ini, nah itu nggak ada gunanya juga sih. You can try feeding and you see how is the defecation and all. If it goes well, then maybe you can keep the snake. If not, it's one of the humanely euthanizing will be one of the methods I would recommend. This is a Tropidolamus regulari. You can see there's a fang which overgrew. The old fang, gigi yang lama, taring yang lama belum cabut, jadi kita harus cabutkan manual. And then you can see ini adalah taring yang lama. Selalu ini bisa mengakibatkan stomatitis. Okay, stomatitis yang parah. It actually a periodontal disease di ular. Dia akan menyebabkan nusuk-nusuk ke bagian palatum, bagian atas itu, dan kadang menyebabkan sampai infeksi parah banget. Terkadang stomatitis ini akan melanjut lagi menjadi what do you call that, pneumonia atau rhinitis yang ringan, sometimes even bad. Okay, respiration infection in snakes. And then let's see, there's one study case that managed to publish in Bogor actually, RC. It was abscess removal in a desert horn viper. I would like to share this case with you all. This was a 7-year-old Cerates cerates. It had a lump in the caudal part of the body. We did some physical examination. We felt the mass was solid, and tried doing FNA, it didn't really work. So we were like, okay, go in, remove it. Differential was a tumor or even abscess. Abscess in reptiles, sometimes it can be really hard and so on. So, you can't really say it's like watery abscess. And then surgically, we tried removing it. I'd like to tell you a little bit about the chemical restraining in this snake. Kita menggunakan, what do you call that, Zolatil, the 7 mg per kilogram. That was the sedation, and then we continue with isoflurane. It was very smooth, 7 mg, very smooth. You can see a lot of books which will say 3 to 6 mg of Zolatil, but there are some which says 3 to 10, and I really like the 7 mg. There's some of my friends in Europe, they also use 7 mg on pit vipers and vipers. It works very smooth. Very goes a deep anesthesia, so it was pretty good. You can also use, maybe later we can talk about it. And then, we removed everything. It was capsulated, it was small, it was circular. We had to remove it manually one by one. Accidentally, kalau kamu pecahkan kapsul itu, nananya itu akan kayak, it won't break down into water, tapi dia kayak mengganggu the whole thing. So you have to like debride it slowly. Proper cleaning, and then we managed to remove it. You can see it was all like encapsulated things. Okay, we removed it. These are the X-rays. One more thing I want to say, kerates. Most of the pit vipers, it's really, or vipers, this is a viper. It's really, really difficult to get them into tubes. So the water technique, it will be really helpful, okay? And don't try this at home alone. You always remember, I know people, vet students, yang kena gigit ular sampai pengsan di dalam kamar, banyak sih. Jadi tolong hati-hati ya. Yeah. And then, post-operative care, ular juga merasa sakit, walaupun itu berbisa. You can use meloxicam di 0,4 mg. You can give tramadol di 10 mg. These were the doses, I suppose, for this particular snake. And sometimes you can even use carprofen 1 to 4 mg. Meloxicam selalu mereka bilang 0,1 sampai 0,2, tapi you can see more literatures like show you this is the particular book I follow this, and we go with 0.4 directly, works pretty well. Ini before and after, not the greatest picture, but trust me, we had little space to actually close the whole thing up. It was an abscess, so abscess wounds you don't really like to close them up directly. Tapi di kasus yang ini soalnya kalau kita biarin, jadi kita debride, benar-benar debride, and then clean everything up, and then suture it up. This was a snake after a few months. Itu udah ditempatin di dalam kandang pasir ya, kerates, di like pasir. Wasn't the best environment. Okay, people, they always just keep snakes for whatever reason, and it was looking much better. Okay, and then these are some of the references I've used in this presentation, Boyer, divers, and so on. And also I would like to show Mark Roche. He has been one of the greatest herpetologists for venomous snakes. I use a lot of his books, and there are some local people also in Indonesia, Bapak Riza Marlon, and so on. You can use their books to identify snakes, Richira, and so on. These people, they work a lot. All this, and then I'll say atur nuhun, matur sembah nuhun, terima kasih, and thank you. Kalau ada persoalan, monggo persilakan.
Baik, terima kasih banyak Dokter Puveanthan atas materi yang telah disampaikan. Jadi tadi kita sudah melihat ada dua pokok bahasan. Yang pertama hepatologi general secara umumnya, dan juga pembahasan lebih spesifik dan rincinya ya. Tadi kita lihat ada cara surgery-nya dan sebagainya. Dan untuk teman-teman yang masih ada di room, kami ingatkan untuk mengisi presensi kuliah umum kita pada malam ini. Sudah disebar linknya di kolom chat, bisa langsung diisi. Dan sekarang mungkin kita bisa lanjut ke sesi berikutnya, yaitu sesi diskusi.
Doc, can I ask a question, Doc? Hello?
Yeah, can you hear me?
Yeah, I can, Doc.
Sean, yeah?
Yeah, Sean, Doc.
Yeah.
Sorry about that. Doc, I wanted to ask you, when we talk about the venom composition of certain snakes, let's say pit vipers,
Okay.
we know that the basic understanding is whether it's based on hemotoxic or neurotoxic is derived from its ecosystem and its habitat.
Yep.
In certain instances where, as in Thailand, there have been recorded hybrids of macrops and albolabris being, how would I say, mating together and creating natural hybrids.
Yeah.
In that consideration, how would its venom composition be based on the fact that its habitat is also the same, but in certain compositions it may be different? How would its venom turn out to be if it's a hybrid?
Oh, okay. That's a strong question. Yeah, that's a question for a PhD. Maybe Dr. Brian Fry should answer here. But let me just give you my thoughts here.
All right.
If you look at this, okay, it's still a debatable thing that many people are still using, like abu, like Cerumenthe bisa ular,
Yep.
in Indonesia for even insularis or even albolabris spikes. Okay.
Yes.
I'm not really sure how will the hybrid combination be for the proteins and everything,
Okay.
but that will be a very interesting study. I've never worked with macrobes, but you were telling albolabris, right?
Yes.
Okay, yeah, I'm not really sure about how the proteins would be.
All right.
But I'm pretty sure like Thailand is producing a lot of antivenom and so on. These are wild ones, right? You're talking
Yeah,
about
correct.
captive human dealing with this.
Yeah.
If you're asking about the protein stuff, then I'll say it could be in between both. Okay.
All right.
Or maybe a combo of some mixtures, cocktails like
Okay.
that. But if you're asking me about the antivenom, I'll say maybe you can still use albolabris antivenom to reduce certain effects from the certain combination of proteins we have in the venom.
All right. Due to because it's still made up a part of albolabris and maybe macrobes as well.
Yeah, and
right.
I'm pretty sure Thailand, they have the albolabris antivenom, but
Yep, they do.
macrobes, I'm not really sure, man.
For macrobes, they don't. They actually, because the macrobes bite usually for humans is usually very, very not that detrimental.
Yeah.
So with from my research, it's usually just immobilization, and it's usually not an issue after that.
Okay. If that is the thing, that would be interesting.
Yeah.
You can just go with the albolabris antivenom, maybe, you know? Yeah.
All right. Thanks, Doc.
Yeah, welcome, man.
Baik, terima kasih Kak Sean atas pertanyaannya. Sepertinya tadi pertanyaannya based in true story ya Kak ya. Jadi mungkin teman-teman yang lain yang ingin bertanya bisa nih langsung aja dengan format pertanyaan yang sudah ada di kolom chat, yaitu nama, _instansi, dan _tanya. Nanti kalau sudah akan saya panggil, lalu bisa dibacakan pertanyaannya. Oke dok, kita ada satu penanya dulu nih, yaitu dari Dean dari IPB. Bisa on mic Dean untuk ditanyakan pertanyaannya?
Bisa Kak, tes.
Ya, terdengar.
Terdengar. Okay, Doctor, thank you so much for your lecture. I'd like to ask something that you mentioned before. It's dosis for meloxicam, tramadol, for snack. Can you repeat that for me, doctor? Because I want to write that down, but
Yeah, I get you.
yes.
Wes, ada lagi. Ya, dosis yang kita gunakan itu variasinya banyak ya. Tergantung sekarang kalau omong-omong dengan Pak Riza Marlon, dia bilang ustadzmu siapa? Ya ikutin itu. Ya, kalau aku sih bilangnya I like to use meloxicam at 0.4. Oke, seharusnya dosisnya itu kalau kamu lihat di buku 0,1 sampai 0,4. Tapi 0,1, 0,2 banyak pernah aku kehilangan reptil. And when we go with the higher, this one you can see, it works better. But please be very careful when the animal is dehydrated. Okay, this works with all reptiles. When the animal is dehydrated, it could be having some renal issues. When they are having renal issues, please be very careful with using NSAIDs. Oke, meloxicam atau apapun. Untuk tramadol is it's an opioid also. You can use it at 10 mg per kilogram, itu lumayan bagus sih. Aku sering combo itu dua. Nah, combo meloxicam and what do you call that, tramadol, it gives a good smooth recovery for pain management and so on. Selain itu mau apa, Tian?
Anything, Doc? I'm not really familiar with snake medicine, but I'd like to write it down.
Ya. Ya, batuknya nggak kelihatan. Carprofen bisa juga sih. Carprofen kamu bisa berikan dari 1 sampai 4 mg per kilo. Selain itu butofanol dan lain-lain. Cuma butofanol saya nggak pernah malah menggunakannya. Jadi aku nggak tahu dosisnya. Sering kalau di Malaysia atau Indonesia carprofen masih kalian bisa gunakan. Cuma injeksinya itu bisa setiap 24 jam atau setiap 48 jam. Nah, untuk carprofen itu atau meloxicam saya sering gunakannya itu 2 hari sekali untuk pain management di reptil. Apalagi yang di berbisa. Nah, terkadang aku berikannya itu setiap 3 hari sekali. Oke. Kenapa 3 hari sekali? Soalnya ada beberapa antibiotik seperti ceftazidime yang Q72 jam. Jadi setiap 72 jam atau setiap 3 hari sekali kamu menggunakan antibiotika itu. Nah, apabila kamu menggunakan ceftazidime setiap 72 jam, itu kamu bisa barengin dengan yang lain. Nah, pas kamu kerja dengan ular berbisa atau reptil yang berbisa, kamu nggak mau handle-nya itu sering-sering. Nah, cari maut namanya. Nah, kalau pas kayak gitu ya 72 jam sekali, nah kalian aku barengin painkillernya. Memang sih itu akan kurang sedikit efeknya. Cuma ya keselamatan itu juga penting, kecuali kalian bisa handle setiap hari. Untuk kerates ya hampir 2 hari sekali saya handle. Untuk ada beberapa kasus lagi yang kita bisa handle setiap hari. Nah, Dokter Sulham dulu pernah ada insul katanya setiap hari kalau nggak salah dia berikan meloxicam kalau nggak salah. Bisa aja. Kalau ular berbisa ya kalian hati-hati aja. Terima kasih.
Dokter. Thank you so much for your answer.
Sami-sami.
Baik, mungkin Dean sudah cukup puas ya dengan jawabannya. Oke, mungkin kita bisa lanjut aja ya, Dok. Setelah Dean yang bertanya, ada Sulham dari Universitas Udayana. Mungkin untuk Sulham bisa dipersilakan untuk on-mic. Apakah Sulham ada di room? Atau kita lanjut dulu ke Regine dari IPB. Mungkin Regine bisa silakan di-unmute.
Hello, good evening, Doc. So I want to know, may I know what's the interesting case or maybe the common case that Doc encountered in the snakes? Can be venomous or non-venomous. Thank you.
Okay, honestly, about snakes, there's a lot. Interesting cases. I'd like to say, I've worked with Gila monsters before. That was quite interesting. Gila monsters are venomous reptiles. Sadly, back then, I think maybe Dr. Sulham was with me there. I'm not really sure. Or Beta, I'm not sure. Tapi we forgot to take pictures and so on. So documentation was bad. It was an 18-year-old Gila monster. It was interesting because it was venomous. You know that there's no anti-venom. The nearest you can get it is maybe Thailand. I'm not sure. Maybe Sean can update us about it. Or maybe I've got to go to America to get it. Gila monster anti-venom. But it's it was quite interesting because you have the stress load in you to actually handle it and get it treated. Other reptiles, I would say, there's a lot of species of the endangered animals also. If you can work with like wildlife rescue centers, zoos, and so on, you get the opportunity to work with them. Yeah, by you. And can't remember this. Just a lot.
Okay, thank you, Doc.
Yeah.
Baik Kak, untuk selanjutnya mungkin apakah Kak Sulham dari ini sudah di room? Oh iya, baik. Mungkin akan saya bacakan aja ya Dok pertanyaan dari Kak Sulham. Izin bertanya mengenai kasus ular yang dehidrasi dan menggunakan melox, apakah masih tetap berisiko jika sudah dibarengi dengan food therapy? Terima kasih.
Ya, resikonya pasti ada. Resikonya pasti ada. Nah, kenapa sekarang kamu menggunakan meloxicam? Contohnya, ini ada operasi, terus kamu mau gunakan meloxicam. Kamu suspek dia sudah dehidrasi, ya udah kamu perbaiki fluid terapinya dulu. Sama kayak anjing kucing actually. Nggak ada rocket science di sini. Ini kamu tetap rehydrate the animal, treat the dehydration, and then you go in for surgery. Pasti ada resiko. Terkadang kalau aku nggak mau menggunakan meloxicam, or any other NSAIDs yang ini, aku akan lebih ke maybe tramadol or something lighter, atau dosis meloxicam kamu bisa turunin. Yang penting ada analgesiknya sedikit, kayak gitu. Ini adalah dokter hewan itu katanya seni juga ya. Ya, kalian harus berkarya lah di situ. Ya, gimana?
Bagaimana Kak Sulham, apakah sudah cukup puas dengan jawabannya? Mungkin kita lanjut saja, kita ke pertanyaan dari Ignatius Samuel Alsanda dari Universitas Brawijaya. Dipersilakan untuk unmute.
Thank you for the chance. Izin bertanya, is there any difference in case of anatomical or physiological between venomous and non-venomous snakes? And also, is the medication treatment also there's a difference or not? Thank you.
Okay, venomous and non-venomous. Is there anything difference in the anatomy? Yes, especially bagian kepala. Okay, you know that there's a few types. It could be, if it's a non-venomous, it could be a glypa. Okay, if it's a venomous, then it could be a petroglypha, osteoglypha, or even a mesenoglypha, solenoglypha. So, the anatomically it's different by just the fangs. And then we got to see also there could be differences where it also has a venom gland. Okay, that's an additional anatomy in certain venomous reptiles. And then if you're asking me if there's any differences other than that, yes. I can't say yes to all snakes. It's quite complicated with snakes. There's a lot of species. It's a very good question. I will say that basically they have the same organs. Additionally, there might be some venom glands in venomous reptiles. So I'll say you've got to still do everything the same. Everything is the same. So just be careful with the head. That's about it, the fangs. Anything else? Ignatius Samuel. Itu Latin name atau your real name? It's a cool name.
That's my real name.
Damn, man.
Okay, thank you so much for the answer, doctor.
Yeah, I hope I answered you, man. Yeah.
Oke, terima kasih Ignatius atas pertanyaannya. Kita lanjut aja ke Vincentia dari IPB. Silakan.
Oke, terima kasih. Hi Dok, how are you?
Hai Dok, apa kabar? Kumaha damang atuh?
Damang. Okay, I would like to ask a question. So, And by the way, I'm not familiar with wildlife because now currently I'm also working with chickens. So count me as a commoner here. I want to ask a basic question. How do I differentiate a venomous and non-venomous snake in the easiest way?
Okay. This is a very tricky question. It depends. Okay, if you ask me, the easiest way is just stay out of the sight, stay out of snakes, don't get close to them, and so on. But even if you see one, then maybe you have to treat it like it's a venomous snake. When you don't know the species, the certain species, if you don't know them, then I will say, please, treat it as if it's a venomous one. And if you can see this particular snake, how do you say if it's a venomous or a non-venomous? Anyone from Bogor, you got to see geographically. In Bogor, there is maybe, I'm not sure how many species. Like in Bali, there's about 6 or 7 species which is deadly to humans. Okay, we know that these are the species which we really got to be careful. Ular hijau, orai hijau, ya ada beberapa, ada what lipi gadang, which is what do you call that? Hijau ekor merah, ada 2 hijau ekor merah itu, ada Goniosoma, ada Tremorosaurus. So there's a lot of things, but head shape gives you a basic example. When you have like a triangular head shape, then you will say that it is a venomous snake. It could be a venomous snake, it could be a deadly one. Another way I will say is like maybe to get certain books like this, they will just identify you, help you identify certain snakes. Atau mungkin Satli IPB, ya, orang ini di Jawa Barat juga mungkin you can do a poster to help them identify all the snakes and so on. It is the best is actually to just leave the snake, don't get too close to it. If I say color, then cobra is black, a spitting cobra is black, so I'm not going to answer you. It all depends on the particular species, which is quite difficult for me to answer this question.
Okay. Mind if I ask another question?
Yeah, please go ahead.
Okay. Currently, I'm working at a farm. My surrounding is a rice field. Any particular snake you think I should watch out?
Okay, rice field. Heaven for snakes. They'll be filled with rats.
No, actually, I got a lot of snakes.
Yeah, I'm getting there. Paddy, rice, you have rice, and then you have rats. When you have rats, snakes are going to be there. So there will be a lot of species of snakes there. I will guess, where is this? Is it in Jawa Barat?
Yes.
Yeah, so you're going to have Pittosporus there. You're going to have, these are non-venomous ones. You will even have like maybe some ular kopi, Elavera dieta, now it's Flaclonetius, can't even pronounce it properly. You have a lot of other species, like maybe the cobras will be there also. You got to be careful. Don't always wait for them to hood up and then, there's a cobra. Sometimes you can tell, Indians, they like to use this to call the snakes. You can even use that maybe. Don't use that, you will not call the snakes. So you got to be careful with snakes. And what are the other species you will encounter? Pythons might be there. When there are rats, you can see bigger predators. Pythons might be there and so on. So just be careful of that. Snake proofs are not easy to be done, but you can always have animals like cats and so on to look after, to at least show you that there's a snake there.
Okay, what about bamboo? I got a lot of bamboo.
You got a lot of bamboo. That's a heaven for cobras.
Is it?
Yeah, it's a heaven for any snakes actually.
Okay.
The white-lipped pit viper or Trimerosaurus arbolabris, they also have another name for it. It is known as the bamboo pit viper. I might be wrong, guys. You can correct me. And there was only once out of maybe 50 or 60 bamboo. This pit viper I've seen only once. I saw it in a bamboo, but it's a nice place. It's a very cooling area for snakes to actually go and lay eggs. Cobras love it. King cobras, they build nests, and a lot of cases you can see with the Bali Reptile Rescue, they do find a lot of king cobras near the bamboo plantation. They get the leaves together and they sit on the eggs, they guard the eggs. Bamboo plantation is heaven for a lot of snakes.
Okay. Okay, I guess. Thank you. That's all.
Nice talking to you, Doctor.
Terima kasih, Dokter. Maaf sebelumnya tadi saya sering memanggil dokter ya, Dokter Kim. Terima kasih. Mungkin selanjutnya kita akan ke pertanyaan dari Nurul dari UB. Silakan Nurul, bisa di-unmute.
Thank you for the opportunity. Doc, I really want to ask about what if there is an accident happen while we taking care of these venomous snakes. For example, we get a bite or maybe another accident. What is the first aid or the medicines that we should keep at our clinics if there is an accident happen? Thank you.
Yeah, that's very good. Before even you handle a venomous snake, you should definitely go and find out which hospital have at least SABU, And if you're working with an exotic species, what do I mean by exotic species that is not in the SABU list? Please be extremely careful. Even worse, if you're going to work with an exotic species not from Indonesia. Jadi contohnya kayak mungkin there are rattlesnakes I know in Indonesia. There are also Najacautia. We don't have the antivenom. Paling dekat itu di Thailand. Okay, so it is. That's why I say you have zero chances to make errors there. But if you get a bite of this venomous snake, and if it is exotic, if it's non-exotic, jadi ular yang lokal, please go to the nearest hospital or center which treats for venomous snakes, and make sure, please call the hospital, ask them if they have the antivenom. Okay. Dulu aku pernah di Bogor, I got an experience, pernah dengan kawan yang kegigit weling, Bungarus candidus. And then kita bawa dia ke Karya Bakti, and then from Karya Bakti we had to move him to another private hospital, I can't remember, di Jalan Baru somewhere there. And we hampir habis ampul sabu itu 19 atau 20 ampul. Satu-satu ampul itu 300 sampai 500 ribu per ampul waktu itu. Dan di kebanyakan rumah sakit itu cuma ada 1 atau 2 ampul. Nah, kita harus ada beberapa teman yang pergi nyari dari rumah sakit lain, kita nyari dapatin. So please make sure you have the stock of antivenom near you. If you don't, if it's an exotic species of snake and you got bitten, maybe I'm not really sure. Maybe Dr. Tri Maharani, she is working with venom of in Indonesia, ular-ular yang berbisa. You might want to contact her. And so, but you should always be very careful. Please be very careful when you're handling them. I see a lot of us, including myself, we have been more into attraction rather than education or work of purpose. Attraction is something really interesting. It's really cool to handle a snake with no hooks, a venomous snake, with no tongs and so on. But one silly mistake, you never know. One mistake, and you bam, you're gone. It's either life or death. If it's death, then you are giving a bad image for the particular snake. So please, I ask all vets or vet students, when you're handling venomous snakes, please be extremely careful. Don't do silly mistakes. Don't be stupid. Okay, I've seen a lot of us being stupid, and don't handle them unnecessarily. Okay, and so on. I'm so sorry, Nurul, aku udah malah lanjut kemana. Jadi ya itu, tolong hati-hati dengan handling, and I will say contact the nearest hospital yang ada, rumah sakit yang ada antivenom sabu. Please call and ask. Di Bali, we used to, sekarang aku nggak tahu ya, Rods, ini tugas mungkin untuk Rods juga lah. dulu kita ke rumah sakit Sangla, dan sampai ada beberapa dari kita yang bilang ke mereka kalau ada gigitan ular, coba hubungi kita, kita lagi dekat, mungkin kita bisa identifikasi dari jenis-jenis gigitan. Nah, mungkin sekarang sulit ya dengan COVID, dengan pandemik yang sedang terjadi ini. But yeah, these are the possibilities. You got to find out the hospital. Okay, thank you, Nurul. Ada apa-apa lagi, Nurul?
Thank you, Doctor, for your answers. That's it. I think this is very fascinating material for me to learn, but I cannot deny it that as
You cannot deny what? Sorry.
veterinarian, I'm still very good. So thank you, Mission.
I think that's all, Dok.
Yeah.
Oke, terima kasih Kak Nurul atas pertanyaannya. Kita lanjut ke Made dari IPB. Silakan ditanyakan, Made. Mungkin kalau Made belum ada di room, bisa mungkin dituliskan aja pertanyaannya. Sekarang kita lanjut ke Dokter Dewo dari IPB. Persilakan, Dokter. Oke, Made, silakan ditulis aja pertanyaannya di kolom chat.
Bahasa Bali pun bisa. Tentang api. Wow, it's 3 questions ya.
Mungkin bisa dijawab pertanyaan dari Dokter Dewo dulu, Dok.
Bisa, yang mana ya?
Ini ada 3 pertanyaan. Yang pertama, how do you treat flu in snakes? Is it effective to use nebulizer for snakes? If yes, then what kind of meds you use for nebulizer? Second question is, what antibiotics you use often for your patients, especially snake and lizard? And the last one is, what medication do you use to treat ticks on snakes? Oke.
Dari satu persatu ya.
Ya, apa Dok? Dari pertanyaan pertama aja dulu.
Okay, nebulizer and snakes ya. Very good question. I like to use, saya suka campurin gentamicin dengan sabutamol, tapi ini adalah karya setiap orang ya. Kalau kamu lihat di BSAVA, kalau nggak salah di bagian gentamicinnya itu mereka ada tulis dosisnya itu. Nah, aku ikutin yang itu. Jadi gentamicin BSAVA kalau nggak salah edisi ke-7 deh. Nah, dosisnya persis aku nggak ingat, tapi sabutamol dan gentamicin itu adalah beberapa yang aku gunakan untuk nebulizer-nya ya. Untuk how do I treat flu? Okay, now flu atau among the reptile keepers it's known as RI ya, RI itu respiration infection. Nah, respiration infection ini terjadi kenapa? Itu kamu harus cari tahu dulu. Nah, selalunya respiration infection ini terjadi karena masalah kandang, bukan masalah di hewannya langsung. Stres yang terlalu tinggi juga akan menyebabkan respiration infection. Salah satu yang sering saya lihat ini adalah apabila ularnya itu kena respiration infection ya, awalnya itu terjadi sebab ularnya itu pipis, kencing, ya, pipis, dan mereka nggak bersihin kandang. Nah, apabila nggak bersihin kandang, ada beberapa ular yang sensitif. They don't like to sit on the urine. Ya. Apa yang mereka akan lakukan? Mereka nyondol. Okay? Sodor, nyondol, whatever you call that. And then what happens is they get blisters in the mouth. Stomatitis and so on. And then what happens sometimes it enters the respiration system and they get, so it's always like a secondary problem which becomes the main reason. I always like to use, it depends on the snake also. I've tried a few. I've tried trimethoprim sulfas. I can't remember the dosages. You can Google that up. It works. I've tried, but orally. In snakes, oral medications, you got to put tube every time you're giving it. You can't just put it in the mouth and then just flush it. It doesn't work that way. You got to put a tube until inside the stomach, and then do it. And then I like to also use enrofloxacin, if sometimes marbo, ceftazidime. Depends on the snake, depends on the condition. Like now, if it's a venomous snake, I'll go with ceftazidime, cephalosporin, third generations. They work pretty well. And, it's every 72 hours. It gives you a time frame for you not to handle them too much. If it's a species like a ball python or something, maybe if I'm going with Endro, I might do it every day. Endro, you can do like every day or maybe even 48 hours once. So it depends. It depends on this one. So my treatment plan will usually be something like what I've mentioned earlier. Okay. What antibiotics you often use on reptiles, snakes and lizards? Yeah, I like to go with the fluoroquinolones, but I know it's not, they always say don't use like enrofloxacin. They say don't use on growing animals. They might have joint issues. Kalau kamu baca-baca. But honestly, I like to use sometimes with lizards. It depends which kind of lizards. Snakes, I always like to use injectables. Injectables works better. Always remember 1/3 of the body and so on. If for lizards, now it depends on what kind of lizard. If it's an iguana, I can just put a pill in the mouth. It's going to it's going to swallow it. If it's some other lizards like varanids, biawak, itu nggak bisa. You have to do the same thing you're doing with snakes. You got to put a tube in, maybe flush medication or even injectables in the front limbs. So what kind of antibiotic I often use? I use enrofloxacin, I use marbofloxacin, I use ceftazidime. I even use sometimes metro when they have GI problem. I use trimethoprim sulfas, but make sure I also like to use a lot of probiotics. Okay, this enhances a lot. It helps me a lot also. There are some probiotics which helps. I just use any yogurt sometimes. It helps a lot. What meds you use to treat ticks on snake? Yeah, interesting. I like to use. Sometimes I use ivermectin, but I'm very careful with ivermectin. I had last time a case of ivermectin toxicity in a dog. Ever since that, blacklist. You can even use doramectin. You can use, but I like to use anything topical. Like sometimes I like to spray fipronil on snakes. Be careful of usages of ivermectin in certain species. Tortoises especially, they're toxin. Okay. Skinks, blue tongue skinks, or any skinks, please be very careful with ivermectin usage. What else? Indigo snakes, if I'm not mistaken, they are also sensitive, but we don't really have indigo snakes in Indonesia, so not to worry too much. I'll say even there was a research done by a fellow friend, Putri. Yeah, and they used a topical treatment of ivermectin, which was sprayed on a Burmese python, and it helped a little bit. But I like fipronil, it's safer. I've used deltamethrin, Kapur barus. Please be very careful. It causes toxicity in some snakes. I personally have seen a case, and we're actually writing a paper about it. Let's see. I think I've answered your question. Thank you, Dr. Deva.
Mungkin itu jawaban dari pertanyaan Dr. Dewo. Apakah sudah menjawab, dokter? Mungkin bisa dijawab lewat chat. Kita lanjut ke pertanyaan dari Made ya, dok. Jadi pertanyaannya, I have interest in wild snakes parasite. What are the most common, and is there any type that can also infect human? Gitu, dok.
I'm not a parasite person. Okay, first of all, ini Made ya?
Made, cantik.
Okay. Beli Made. So I'm not a parasite person, but I've recently read a paper from Erlangga, kalau nggak salah. Ada dosen parasitologinya itu. It's about Spirometra di insularis, and it's 100%. Coba kalian baru tahun ini kok, baru-baru ini. It was a very interesting paper. They found Spirometra in almost all the insularis, if I'm not mistaken. So yeah, it can in fact. What else? I will say there are some ticks could also live under, on humans, I guess. I have the book right beside of me, tapi tapi aku belum ini. I'm not a parasite person, but just be careful. Try to avoid. But I know Spirometra. Recently, I just read like in a journal published from Dr. I can't remember his name, tapi dari Erlangga sih. He had a few papers yang zoonotic terhadap I mean, it's zoonotic cases and parasites. Maybe you want to follow up kasusnya. Mungkin kontak saya atau mungkin saya boleh link nanti setelah setelah chat ini. Dokter Suksma.
Baik, thanks Dokter Ramade. Oke, mungkin ini kita lanjut, ada pertanyaan lagi tadi dari Ignatius Samuel. Mungkin bisa silakan ditanyakan.
Okay, doctor, sorry for asking again. I just thought about it after I asked the last question. Okay, I used to rescue a python. Like it has a trauma in his head that the doctor have to remove the teeth, like most of the teeth. I'm asking, like, if it's happened in venomous snake, like, do you also have to remove the fangs? And if you have to, will it cause like the side effect of it? Thank you.
Yeah, it's an interesting question. Venomous snakes and the fangs being removed. Yes, definitely there will be some side effects in the sense that this particular snake, why does it have venom, is also to digest the prey. When it doesn't inject the venom into the prey, it's going to take a longer time for it to digest the prey. Okay, now you're saying if it's removed, yeah, it will grow back. Okay, as long as you are not going to remove the whole section in the maxilla region. But I think it will grow back, and the function will be there because the gland is still there, and all snakes and all reptiles in general, all Diapsidas, they actually, everything will regrow. Hello. Yeah. Anything I missed, Samuel?
Yeah, I think that's already answered my question. Thank you, doctor.
Okay, Samuel.
Oke, itu tadi pertanyaan dari Kak Samuel adalah pertanyaan terakhir. Jadi ini terakhir akan ditutup dari Kak Sean dari IPB. Kak Sean mungkin akan menambahkan, Dok. Kak Sean maybe will add some explanation.
Doc, for just now's snake bite case that they wanted to know if there's anti-venom. Me, I've been working with Dr. Tree to actually provide anti-venom to the rumah sakit in Bogor. So if and when you guys do get bitten and you guys need to go to rumah sakit in Bogor, if it's Karya Bakti or even the other one, you guys will be taken care of completely. Yeah. So the anti-venom is available.
Great, Sean. Which anti-venom are we talking about?
The most common ones for like Sabu with the most common 4 species are available. But as and when, because Bogor has Albolabris, Dr. Tree is on the list to be able to give us the Albolabris anti-venom as well. Hello.
Okay. Thank you Kak Son for your
Yo.
information. Mungkin itu salah satu informasi yang sangat bermanfaat ya. Jadi untuk kita yang especially sih teman-teman FKH di Dramaga ya. Jadi kita kalau misalnya nanti nggak sengaja, tapi jangan sampai ya, mungkin kalau amit-amitnya kita kena, kita mungkin bisa ke KBP gitu ya guys. Jadi sebelum kita lanjut ke sesi berikutnya, kepada seluruh peserta acara dipersilakan untuk mengisi presensi acara dulu ya pada link yang sudah di-send di kolom chat. Untuk teman-teman yang tadi sudah memperhatikan dan juga udah bertanya, saya ucapkan terima kasih sekali lagi, juga penjelasan dari Dokter Puveanthan yang sangat bermanfaat dan pastinya menambah insight kita, apalagi di hewan-hewan reptil yang berbisa umumnya ya. Semoga nanti itu semua ilmunya akan bermanfaat. Baik, silakan diisi dulu presensinya teman-teman. Bisa kita lanjutkan ke sesi berikutnya, sesi next. Baik, untuk sesi berikutnya kita akan mengadakan foto bersama. Jadi untuk teman-teman yang masih pada off-cam, bisa dipersilakan nih untuk on-cam terlebih dahulu. Kita akan sejenak foto bersama. Kepada panitia yang bertugas, Casey, dipersilakan untuk mengambil fotonya ya.
Oke. Semuanya on cam ya. Oke, slide pertama dulu. 1, 2, 3. Smile. Slide kedua. 1, 2, 3. Smile. Slide terakhir. 1, 2, 3. Oke, sudah ya.
Baik, terima kasih Casey. Bisa kita lanjut. Jadi itu tadi adalah akhir dari acara kuliah kita malam hari ini. Khususnya teman-teman yang sudah hadir sampai pukul sekian ini, saya ucapkan terima kasih telah menyempatkan waktunya kepada Dokter Puveanthan juga, di mana di Malaysia sekarang udah jam 9:10 ya dok ya. Dan untuk teman-teman internasional dari Malaysia yang juga sudah hadir, terima kasih banyak. Dan teman-teman yang sudah hadir lainnya dari universitas lain. Jangan lupa untuk mengisi presensi, karena nanti akan dibagikan sertifikatnya berdasarkan hasil absen tersebut. Akhir kata, mohon maaf atas segala kekurangan. Mungkin nanti kita akan ada kuliah umum lagi yang chapter 2 dari klaster Herpet Himpro Satwa Liar di bulan ini juga. Jadi teman-teman tetap stay tune dan semoga kita bisa bertemu lagi di kuliah umum selanjutnya. Terima kasih sudah hadir, sudah bisa meninggalkan room ini. Terima kasih Dokter Pufan.
Terima kasih semua. Maaf ya kalau ada salah kata dan
Thanks Doc for coming.
Terima kasih Dok.
matur nuwun, matur sembah nuwun, matur suksma. Thank you everyone. Have a great day. Please be careful Stay safe, not only for COVID but also for venomous reptiles.
Ramon, listen to that, Ramon.
Ya, paham.